I'm excited to be here with you all today. I am Ibelis, or Ibelis in Espanol. I am the founder and CEO of Radical Health. I would love it if y'all in the chat could just help me out so I know who's here so far. I know this is being recorded, but would you put in your name, if you have a preferred pronoun, where home is for you, and the last thing you ate or drank. For me, I'm coming to you right now. Home for me is in the Bronx. I'm coming to you from Puerto Rico, so I had some pan sobao a little earlier. But I'm excited to kind of get to know you and jumpstart us into this talk today. I think a lot of the speakers that I heard earlier were all talking about health and health equity. And I think for me, and we're going to start seeing some comments in here. This is great. I'm not your traditional health tech founder, or I'm not what would have been considered your traditional health tech founder. My journey into health was a very, very different one. I mentioned that I'm born and raised in the Bronx. I wanted to be a doctor when I was growing up, and really, really, really quickly, I found out that that wasn't going to be the easiest thing. You don't show up at your city college and are just like, hey, you prep for that. And that was my first experience with a healthcare system that was behind a paywall and that I learned would be a little more challenging, right, just to bust into. I hustled my way into healthcare. And what you'll read about me on the internet is, yes, I'm the founder and CEO of Radical Health. If you look at my background, I've worked at some of the large biotech companies. I've helped launch drugs and train physicians. I even got into health tech really, really early. So about 11 years ago, started working on apps and prescribing apps to patients. And if you look at it, right, I made it. I made a lot of money. I was in the cool kids club of innovation. I was meeting incredible, brilliant physicians and researchers and healthcare workers. And I made it. But what you don't and what you won't see on the internet is my real life story, where as I was doing all of that, my mom was diagnosed with cancer. And while I was working on an oncology profile for a big pharma company, I had no idea what was going on with my mom's care. I, in fact, had never even met her attending. And it was one of these moments where the dissonance between like what I knew to be true and what I expected and the reality to be a Latina, a Black Latina at that, in the Bronx trying to get care from my mom was wild. And that was one of the moments where it dawned on me, like, oh yeah, like this isn't fair. No matter what I do, no matter who I am, no matter who I know, this isn't fair. And I think we all here either have our own healthcare horror stories or we know someone who does. And it's not that far-fetched, I think, especially now in a pandemic, that we all know the realities personally. This isn't no longer, I heard of someone next door. We're all experiencing that. And it is a real, and I can go on and on about the realities of this, but it is a real deal thing. When we look at healthcare, it is complicated no matter who you are. Today, there are at least 70 million people in the US who don't understand basic health information. And this does not matter how much money you make, does not matter how smart you are, it is complicated. Beyond that, right? Not only is it complicated, when you think about trust and confidence in a healthcare system, there are only 40% of Black Americans who actually trust the healthcare system to do what's right for them, right? And that's 20% less than your white counterparts. And this is an old study. I want to highlight, this is an old study. It's the pre-pandemic study that I'm referencing here. And we know that that number is increasing daily. And when we add in, right, so it's just complicated. We don't really trust or have confidence in the healthcare system, then we're less engaged. So only 50% of people, or 50% of people who have low health literacy, and we'll talk more about that in a minute, ask their doctors 50% less questions. And that just means that my grandfather was this way. We'd go to the hospital, and outside of his doctor's office, he was a strong Puerto Rican man out here, and he'd be in there and just yes, yes. And I knew that he wasn't comfortable. I knew that he'd understand, but he'd be like, oh, yeah, and just agreeing. And I think this starts to highlight just how complicated and how messed up, right, what we're working with today is. When we think about health equity. And I also want to add a caveat in here that a good friend of mine, Natalie Molina Nino, says, health equity in the US lacks ambition, right? It's not just enough to want equity, we need to have more. But there are things that have worked. And so when we look at what has worked in the past, we start to get a little radical. When we look at some of the initiatives led by the community, specifically here are examples from the Black Panthers, the Young Lords, who I'm not sure that they would categorize themselves as a health company or a health organization or even health equity, right? But some of the initiatives that they led, they went door to door, the Young Lords went door to door, asking community, hey, what's up? What do you need? Right? Organizing at its core. And instead of, they were expecting something grand, what they got was there was too much trash on the streets. So instead they bought, and there are citations here which will share this, they bought sweepers and garbage bags and piled garbage on Fifth Avenue. And in New York City and across the US, we have trash collection for the most part, equitably, right, from that demonstration. When we think about the Black Panthers, their free school programs, so I know we all might know someone who's in school, a young person who gets free lunch, initiated by the Black Panthers. When we look at both of them had 10-point plans. When we look at the Patient's Bill of Rights today that exists in every hospital system across the US, inspired and led and created by both the Black Panthers and the Young Lords. And so what we see there is not only is this complicated, right? But when we start to think about what does health equity look like, what are we going to do? It is led by the community. And what we saw and what I saw personally, again, being from the Bronx, I'm inspired, right, by both of these organizations. What we saw that it's not enough, right, to put the onus just on the individuals. And if we're going to tackle health equity, it needs to be this multifaceted approach. And so when I look at what we need to do, we created this term called healthcare fluency. We hear a lot, and feel free to jump in and you can put in here, what does healthcare fluency mean to you? What's coming out to you? But we hear a lot about health literacy. We need people to understand. We also hear about we need to get access to care. But it's a little bit more complicated, especially when we're talking about communities that have not been heard, that have been historically silenced, that have not had their voices at the table, that have not been invited to participate. So when we think about health literacy, or health fluency rather, we start to break it down into a few components. For me, it's been 4 key areas. The first being fundamental literacy. And this is kind of, I think, what we all know about. But if we think about it a little deeper, right, this is just the ability to read and write and speak in the primary language used by a healthcare system. This week, we might have all seen a little bit of the links to get COVID tests online. That wasn't, I don't know the availability, but it was a little complicated. And what we need are for people just to understand, this is what I'm ordering, this is what it is, understand the basics there. And that one I think is pretty much kind of the go-to. I think there's another piece, if we move beyond just literacy, and we actually look at scientific knowledge. Now, this is a more informed understanding of the science, the anatomy, a little bit more of the procedures, and generally understanding what your rights are within a healthcare system. This does not mean you have to go to med school, does not mean that you have to know the actual procedures and how, a PCR test works, but really you want to be able to know what's going on and how to ask follow-up questions. You want to know what the risks are, maybe the burdens, the benefits. And this is, I think, one area that we really fall short on and we need to be addressing a little bit more as well. The third pillar of healthcare fluency is cultural perception. And now this is what we're seeing, I think now, as in the US, especially right now, this is a big moment where everyone is trying to undo or try to redo what people are perceiving of the healthcare system. So really cultural perception for us is the beliefs, right, or information that's been passed on to a patient. And this might be, or a person, we'll say, by their family, their friends. A good example of this was when we all started panic buying toilet paper. That was all, right, led, and here, do this. Vaccine hesitancy or lack of confidence in a vaccine right now is another example of that. And when we start to think about the larger culture, right, our key figures, influential figures that are embedded, right, and talking about this, the next piece is a little bit more of the personal confidence. And this is someone's individual trust of the healthcare system. And this might mean, right, how they feel, what they're thinking, how they're going to ask, and how comfortable are they in asking questions and seeking the right care for them at the right time. And it's important to know that cultural perception and personal confidence are closely tied together. And today, I think, and what I'm seeing is it is a lot of top down, right? Understand this, we're going to make this accessible. We're going to make more clinics. We're going to make more access. And I think what we're missing is this collective bridge of bringing people together. I myself, I have a 7-year-old, and I had to think about vaccines, and I had to ask. And I needed to tap into all of these elements to make sure that I was comfortable for my young person to get his vaccine. And more than that, I had to do the same and follow these same steps with him so that he was comfortable. So it was just making sure he understood what was happening, right? Helping him understand, right, what a vaccine was, what was going to happen, the actual science behind it, like answering his questions. He went to school himself and spoke with some of his friends. He's 7. So his friends in New York City, they were giving away $100. So his friends were very excited that they could buy toys with their money. And then for my young person, like, he really needed to be comfortable. And he asked a lot of questions and wanted to take his time. And it showed me really firsthand that this is hard work and it's not easy work, but it can be done. And so through this framework, it inspired me to look at Bell Hooks, who says, right, rarely, if ever, are any of us healed in isolation. Healing is an act of communion. When we think about the healthcare system, again, as a whole, when we think about health equity, I think today it is very much a tech forward. What are we building? What tech are we building that's going to fix this? And where we really need to be is a people forward movement, a community forward movement. We have our healthcare system. There's a lot of talk of the third space. If you aren't familiar with this concept, you have your work and you have your home. And for all of us, we all need a third space. So whether that is with friends, whether that's a run club or church, that third space is really, really important. And in healthcare, that third space does not exist. Where's a space where you are accepted, regardless of whether, and I use the vaccine example a lot, whether you want a vaccine or you don't? Where are you accepted? We work a lot with community, and for folks who are vaccine hesitant, our approach was, okay, that's great. Now, what are you doing to be safe? You don't have to get vaccinated today, but are you getting tested? Where do you go when you have questions? If you wanted to get a vaccine, where would you go? How would you go about that? Are you wearing masks? Let's meet people where they are and create community, create connection around health. When I started Radical Health, and Radical Health, what we do today is we use this act of communion, this act of community, this act of conversation to help people have those conversations in real time. So we use Indigenous circle practice where people can have real people-to-people conversations. And we supplement that with tech where people can ask questions and know what their rights are and know what questions to ask maybe when they're in a visit or in the emergency room. And when I started this, and I had this idea 5 years ago, 6 years ago now, actually, everyone thought I was wild. Everyone said, this is not a good idea. There's no way that this is going to work. And what we're finding more and more, and I think even here in this chat, as we're sharing what we ate and the good food and drinks, when we share where home is for us, when we share who we are, not what we do, not our titles, but when we share who we are, we know that that's a deeper connection. And the radical way that we address health equity, the radical way that we actually look at health justice is less about, again, what we do or what roles we play, but how we show up as humans and how we invite community to show up. Our work here at Radical Health is looking at a new way, a new path, one where we are engaging, we're equipping. And I think it's less, I think you would say less empower, although that third E feels really nice, but really helping people have agency to build community around health, to know how to navigate the healthcare system on their own terms. This ultimately comes down to power And I know that this is like, my session here is called, where you need to get radical. The reality is that as we think about getting radical, it really is a radical shift of power back to community. And again, what does this look like, right? If you work at a hospital system, this means, right, listening to the folks who are the most impacted, creating spaces for people to organize and connect. We had a hospital client who was really invested, and we worked with them. And what we found, right, was that their dining hall, the folks who worked in the service industry, and especially in their dining hall, while they had similar insurance, those same people couldn't access the specialists that were employed in the hospital where they served food, right? And these are stories we hear all the time. But we don't get to fix that unless we listen first. We don't get to fix that, right, unless we also create spaces for accountability and transparency so that we know what these issues are we know that these issues are happening. And ultimately, we don't fix that without community. Being here in this time and in this room, and it is a little awkward to be here just talking unless I'm going to look at some of these comments. But again, as we think about where the future of health goes, I really want to emphasize that I think in this moment, there's a lot of funding being put into digital health. There's a lot of funding being put into healthcare and health equity. There's a lot of pressure to go really, really fast, to go and go really, really big. I encourage you all that like this moment is one, especially when we have like a metaverse and we have community, it's one where it's really pivotal for everyone here and everyone outside of here to understand that you have to be intentional. You have to be inclusive. I know plenty of people where we're talking about a metaverse and like folks literally could not get on that USPS link to order their tests. And there's still a great divide. And I don't know that it's necessarily bring those folks along and get them to the next line as much as we need to be mindful and intentional of where people are and meet them where they are. I'm gonna pause the screen here and see if there are any questions or things that I can maybe answer or jump in on. I think there's a question here. So for the work that we do right now, actually everything is virtual. So we do these circles. We use Indigenous circle practice. You go online, so think of a Zoom, but instead of like a Zoom, it's circles. We facilitate conversations using Indigenous circle practice where folks can check in about health topics. So again, we work with population health departments. We work with employers for their employees. We do this in community. So it is 100% virtual, the work that we do right now. A lot of our clients are in New York City, in California, Washington State, Philadelphia. We do stuff kind of across the way for that comment. I don't see any other questions in here. I think a question that I have for folks in the comments, when you think about your work, for those of you who are working in health equity or trying to advance that, what do you see, or kind of what are the things that you see that are working for you right now in regards to community and healthcare fluency? And what are the things that maybe you don't think are working or you'd like to see improve? So one of the questions here, got it. How can we promote collaboration among stakeholders and ensure that we don't leave vulnerable communities behind when adopting new technology? So this one is an interesting one because I think one, it's identifying, I was just talking about this, identifying who are the stakeholders. Realizing, and I was listening earlier to a few other sessions, that different stakeholders are going to have different approach. They're going to be different. I think it's also important to know that, like, and I'll just get into semantics here, like communities themselves aren't vulnerable, right? There's a historic and a systemic piece at play that impacts the communities and why they're left behind. And I think some of that even just comes down to like basic access to internet. Again, I live in the Bronx and in New York City, and at the beginning of the pandemic, I was speaking with school officials, and they're calling and saying, hey, we have missing kids. We don't know where they are, largely because there's no Wi-Fi access and we don't know where, we can't find them. So I think it's important, one, to just recognize, and this is not just a health, like you can use the structural determinants of health as a framework, but there's like a technology issue, but there's a systemic issue at hand and at play. And the reality is, like, we also have to be conscious of that. The way that we promote collaboration among stakeholders and all of them, and my approach is always invite people, get to know them. If we're talking about key leaders, maybe who are really distant and removed, it's really important that, like, one, I'm not the voice for any community, but what I try to do, again, is share my power so that folks from community can come in, invite other folks. And I think a lot of this, I just like to take an organizing approach. I was the community organizer, and it takes some time. And when we think about leaving people behind and adopting new technology, like, I'll just say this, like, there's no one who's using TikTok faster, right, than the communities that are technically behind. There's no one who's not only adopts new cultures and technology, but are also creating it. So I think that's also something to keep in mind, that it's not just a pass down, but I don't know that there's like a what is that called? Like a roadblock in terms of adoption. It's just an invitation to participate. I see some more. I will share my slides. There's also, I wrote an op-ed on health fluency, so I invite you in Latina magazine. So I just put that in the chat for folks to take a look at it. I can share the slides and invite you all to apply that framework, of health fluency. Part of the reasons why I wrote this was because when we think about literacy, it's really quick. There's a power play there to say, oh, they're not literate, they don't have health literacy. And in many ways, that's not true. It's all of these things combined that prevent, that stop, that are, like, again, blockers for folks to really be engaged, myself included. Trying to catch up here on the comments. Great. Any other questions? I can go on and on talking about a bunch of things here. But I do think that, the last thing I guess I'll say with my time here is also just language. Language matters. One of the things for Radical Health is that we very, very, very rarely use the word patience. So when we talk about patience, in Latin, the root word of patient means to suffer. And there's something about inherently the language that we use, how we use it, what we say. To be a healthcare patient, to be someone who's suffering inherently just by the word is really important. We think about, again, healthcare fluency over health literacy. We are really intentional, because I think a part of this is it's fast. It's a system that wasn't designed to be inclusive. Ultimately, I think about my story of wanting to be a doctor. There's a paywall. And whether you pay with dollars to get into the healthcare system as a professional, whether you pay with social capital, it's designed to be exclusive. I think we also see that in terms of, again, language, right? We're getting diagnoses and whatnot. There's language. And so what we're really just trying to do is break that all down through community and conversation. We've got another question here that our community is so bombarded with information. How do we help them with fluency and discernment? They trust certain sources that may further confuse facts. I think this is a really good one because it talks to a little bit about trust. And when you're thinking about community, like, yes, community is bombarded with information. I don't know that that information that they're being bombarded with is actually information that resonates or that is created with them. I think this is why I love so many promotores, community health workers. Christina Leos was talking earlier with Real Talk, and it's young people talking with young people about sexual health. I think what we're looking at here is like how more and more do we create spaces for peers and co-creation. I got to be careful what I say, but I'm in New York City, so there's a lot of stuff around, again, about COVID and all this stuff. And one of the projects that we worked on, we were doing some stuff around opioid overdoses. And so everything's about Narcan and this. And so we did a bunch of circles in community. And the first thing that came out, no one that I know, and if y'all know differently, please put it in the chat. No one was like, I'm going to go out and get some opioids today. Language, right? And so in co-creating, right, even just what we're saying and how we're marketing it, right, it is then a lot more, it's easier for folks to understand. And then I think what you get at in that second part of the question is around trust. And that's something that, like, honestly, I see a lot and I go through a lot of discourse with folks because people just want trust. They just want it. They want to turn it on and have it ready. And what we forget is that trust is earned. The history of the healthcare system is rooted in racism, period, point blank. When we look at the skeletons that we use, is that what they're called, the skeletons? But, the models of the skeletal system, The first one, right, was originally from a slave without consent from Dartmouth. Cato was his name. And the whole history of healthcare and the healthcare system is rooted in all of these horrific stories. And so when we talk about today, oh, we just want people to trust and we want to build, and why aren't they listening? We haven't really done anything to restore or repair. And I think, at its core, kind of the work that I'm really trying to get at, and we think about being radical, is that one, we need to own it. We need to say, and this is like not just on an individual level. I think I really would love to see the day where it's collective, but we've caused a lot of harm. We continue to cause harm. I'm just as guilty of it as you. I am not perfect. One of my favorite writers is Paulo Freire, who talks about the closer we get to power, right? The more oppressive we can be. And this is the reality for all of us. So the more power you have, the more like you can do harm, and we're all guilty of it. But I think the more that we can own it, talk about it, create systems of accountability and share, is where we start to see some change. And I know this is like very high level and can be really, in the sky, but I do think that every day that I step up and I lead with vulnerability, even in my position of power, every time that I lead with, sharing my own stories, not just who I am as, Ivelisse the CEO, but who I am as Ivelisse the mom, the person, the friend, and my own lived experiences, I think the more we start to break down some of these walls. So I invite you, as we think back, to reflect on bell hooks. Rarely, if ever, any of us healed in isolation. Healing is an act of communion, and share with one another, share with your people, your neighbors, your friends, and together, that's how we get this. Thank you all.